Elbow surgeries are performed in what position? Supine. So you don't really have to do much, right? Maybe just an arm board, which we don't really have arm boards that attach. We don't have a true operating room table. We definitely don't have an arm board for that reason. So what we can use for now is going to be my arm board. So the orthotech has got to find a way to attach the arm board, which this is like poorly simulated arm board here. The patient will get moved over to that side of the bed. The arm boards are typically placed right in the middle of the shoulder itself, if that makes sense. So the middle of the arm board will be right about the middle of the shoulder. And the arm will go just like so. You will need, what else would be required? Who's my doctor? You're my doctor? Orthotech, scrub tech. Scrub tech, go wash your hands, get gowned up, man. Do you have your gown and gloves? Don't you touch that.
I know better. I want better.
You're going to need some time.
Can somebody volunteer to take the towels home this weekend? Thank you.
You guys are going to be cleaning with some nasty ass towels. This one's wet as hell.
I thought I'd asked before if that happened again.
It's okay. You're a scrub tech, man. You better be done with it quick. The orthotech's got to put a tourniquet on. How do you put a tourniquet on? So with shoulders, we don't do tourniquets, right? Because you can't tourniquet the head. So a doctor might come over here and help hold. Might. The nurse, you're typing on the computer right now. You're going to help gown this one up whenever he puts his gown on. You're going to make sure he doesn't contaminate. It's your job. Okay? Make sure that the room stays sterile. You're going to put a roll of web roll on first. Just like you would a cast. Nice and tight. This is called an axillary tourniquet. Way up in the axilla. Hope you shave.
Chris, do you say just so after he's trying to glove, like help him, or do the?
No, you just tie them up.
Okay.
That would not work. Let me show you something. You see this? You can't have wrinkles under a tourniquet. Cannot. What I told you, the orthotech is picked on. It's got to be tight. Whoop. It tore. Got it? Just like a cast. Cannot be loose. So put the tourniquet on, and a properly applied tourniquet should go around at least half. Okay? So this is an 18-inch tourniquet, which is most axillary tourniquets. See how this goes? These are pointed up. Got it? That's what you want to do. Nice and tight. It is a little bit like a BP cuff. Is that tight enough? That's actually not bad. But how you want to make it tighter is hold the strings, pull, and then tighten. Tie this. This is your backup. Got it? And because we're doing an elbow, you need as much room as possible down there around the elbow. Okay? Now, an elbow surgery and a hand surgery are kind of set up the same way. This is most of the time. Now, you can do a semi-lateral position for an elbow surgery. That can be done. where you kind of prop the patient up a little bit on their side, like this, so that we can operate on the olecranon. Okay? But most of the time, for now, we're just going to keep it right down there, supine. That's what I want you to know. Once that is on, Dr. Held, Orthotech put that on. What else do you need to do to the patient? Doctor, he's going to go write a note. Go check out what's on Amazon. Orthotech is going, and he's going to manage the music in the room as well.
Okay.
And the Orthotech is left to do what?
Drape?
No.
Ah.
This goes the same for shoulder. A lot of this was in shoulder, and I mentioned it to you in shoulder as well. What else? You have to pad certain areas, right? Remember we talked about that? Yeah. What areas are going to need to be padded? Did he do that right? Nurse?
Back of the heels?
Back of the heels. What else?
Back of the knees, was it? Back of the heels?
Back
No.
of the knees, yeah. Most of the time, relax. They rotate out. When they rotate out, perineal nerve rests right up on the table. So you will always grab some felt. I put some up there. And you will pad underneath each knee, underneath each heel.
In real life, is
Most
it?
of the time, this is egg crated. What else? There's one area we're missing.
Her neck?
We don't do nothing up this part.
Okay.
Remember, the anesthesiologist has got that. You're the nurse. You know what to do.
Do I have any gloves?
Yeah. Get him a new glove. That hand was out of that cuff. Wasn't it not?
I ripped the glove off.
So why are you trying to hide your hand in the cuff?
Because I figured it was better than having it hanging on all the time.
Well, because it was hanging out, he would have to regown. Okay? But because he's hiding it, we're gonna let it go. But if he just dropped a glove or something like that, then he could just do this. Go ahead.
This one has to go in halfway and then he takes it, or
You could either way you want. Just don't touch that back table with your scrubs.
You love this, don't you?
No. A lot of yelling going on.
Do we pad under the arm?
What? No, you don't really need to pad the hips.
The hand?
What about under the arm? Where's the
What about this arm?
Yeah.
What about the
Elbow
ulnar nerve?
ulnar nerve?
Maybe even the hand.
Damn.
Am I out of padding?
Yeah.
We'll,
Towel.
We'll use a towel for now.
How long are they laying for? Usually.
They could lay as long as the case goes. It could be hours. Most surgeries now, they try to get them down within 1 hour. There's elbow. It's a little wet.
We got some nice ones to put over there.
Here's hand. Sorry, you get the wet ones. But he's doing it right. Very good, Will.
Kevin, move away
Just
from
one
the
thing,
table.
huh?
Two things.
So, now that the Orthotech has padded, we got a tourniquet on, the doctor's got the right music in the room, you guys can go scrub your hands. Go wash, get them wet. Scrub tech's going to gown and glove them, right? You now do what? Being the nurse. No, now you're really busy. Now you got to prep her hand or her elbow. You got to put gloves on sterilely. Okay, remember how we tested? You got to put gloves on sterilely and paint that hand with betadine or that elbow with betadine. Get busy. Oh, nurse, he needs a stockinette. There's a stockinette up there in the corner.
I think they're both interchangeable. DuraPrep is betadine, pretty much, right?
Yep, DuraPrep. Well, we're gonna. I have DuraPrep. Where's my DuraPrep? It's in there too, isn't it?
How'd you remember that? I don't remember that.
That was the third.
Yeah. The name of it.
Yep, they need stockinette. You go open that up sterilely for them. You better hurry up because if you tie people up, they're gonna be waiting to operate. The nurse gets it really bad here too.
Hey Chris,
Yes, sir.
so for the nurse though, since everyone's at the table getting county gloves, then where would I put my gloves? Am I just waiting for them or back at the table and do it or?
Put it right on the patient.
Yeah, it doesn't have to be sterile area.
Oh,
Just sterile gloves.
Here, I got a little table for you. You get to do it all right there.
oh, thank
So here's the thing. Got any glove in that correctly? Very good. Before you put those gloves on, think about what you have to do. If anybody here wants to give some input on exactly what he has to do, remember that has to be done sterilely. He has to prep this sterilely, right? So if he puts his gloves on first, what's going to happen? These two aren't going to be able to help him.
He has to open it first.
He has to open up that first and get it ready to where you can just reach in and grab it. Right?
Ah.
So something nurse needs to do.
Chris, then just open it like halfway and then, or just like pop it down like gloves.
Well, think about it. I want you to think about this for a second. You're going to have sterile gloves on. How are you going to be able to access what's inside there?
Oh, by laying it down and opening it up and then reaching into the plastic, pulling it out.
Okay, let me see what your plan is. Very good. I like his plan. It's looking good. Better hurry up, man. You got people that need tied up. Oh, you know what? Why don't you tie her up before you take 5 minutes doing that? Or is this bringing back memories? She hated this because she was the nurse too. She was a nurse. She made me apologize to her. I was so rough on her.
Did you work today? What time did you get out?
Good job, right?
Right.
So FYI, this tourniquet typically goes 100 above systolic. So if their blood pressure is 120 over 80, it would be 100 over the what part?
Diastolic? Is this
120.
diastolic? Wait, say that again?
220 would be what you set the tourniquet to be. Okay? Normally they don't do 220. They go 200, 250, 300. Rare where you see one like 225. But just FYI, the proper test question or answer to that question is 100 above systolic. All right, they're ready to gown. They're draped. So, did he open up that? Did he open up the? Oh, he did. Okay, perfect. You know that's what they're going to get first, right? The stockinette. So you need to unwrap that. No, you're sterile. Everything on there's sterile, right? You can touch anything there. Who, did he open that up sterilely on there? He did?
Yes, he dropped down there.
Okay, because the other way is to unfold it himself. Yeah. What if it fell on the ground? You don't grab a new one. Nurse, can you pick it up? And it's still sterile inside, right?
And then my gloves down? Or- No, we're not.
No, what do you do? I want him to undo that. Unwrap that sterilely so he can get it. Very good. Yell at him. Hell yeah.
You're enjoying this.
That's what I do.
So you do.
Pull that blue pad up.
bring back some serious nightmares. Now he can reach in and grab that for me now.
Oh, cool.
Pull the edges back. I want a nice clean area to grab.
I wouldn't get too crazy at those edges. Very good.
Oh.
Nice. Now you better hurry up and get your gloves on. Nurse. Nurse Kevin. Ready, ready. So you guys were all thinking, I'm never going to be a freaking nurse. Not me, never again. Ah, you touched. You're doing it wrong anyhow because you're supposed to take that glove and put it inside the cup, right? Did we not test on this already? That glove goes inside the cup. You got to get that more on, and then put those fingers inside the cup. Pull it off there. There you go. We just tested on
Stressful.
this like a week ago.
Stressful.
This was a test.
Does someone ever help the patient?
No one helps the nurse. You don't need the Q-tip.
Clutch is in the zone. Smack it, crack
You
it.
see the bottom.
Pop it to stuff.
This is not one that you smack. This you break
Crunch
it.
it.
Turn it
Nice.
upside down.
Muscles from Brussels. You shake it or you just hold it upside down?
You don't hold it upside down. It's fine. So what do you want to do first? Where do you want to wash first? The elbow, technically, you want to clean first. But what I would do in this situation, because that arm needs to be held up. So I would take a little bit of that, put it on the hand where you're going to hold with your other hand.
Okay, so it's from this.
Yeah, wherever you're going to hold. So a little bit there. Don't let that touch the table. Then you're going to pick her hand up. Maybe put some of that on your hand. There you go. And then grab that hand. Hold it up. Now you're going to start at the elbow. Work your way around. Very nice. You're not buffing a car.
Wax on, wax on. That's it. On the shoulder, we did circles.
I don't know.
Is it like more technique or personal preference, or is it?
It doesn't really make a difference. It doesn't have to be circles. But normally they start at the middle and work their way out
Okay.
whenever you're sterilizing one area. So maybe that's why it seems like that. But in this case, with an elbow, you're smaller. Smaller area. So you got to do the whole arm. Now, what you don't want to do is keep going back over to the elbow. Once you're getting further and further away, you don't want to go back to the elbow. So now we work, just keep going up towards the hand. There you go. Now you got to switch hands and do the hand. Ah. Tricky.
I knew he has it
Tricky.
upside down.
There you go. So Orthotech, what do you thinking about right now?
Pizza.
Or that one is not impervious, but you can use that one. That's what we're going to use. So you're going to grab that from your scrub tech.
What's the
You're going to put that, grab the hand from him. Wait. You can't touch anything. So grab that. You don't want to touch with that hand. That needs to protect you. Remember, this isn't sterile yet. There you go. You're going to grab the hand. Watch your gown. Take the hand from him. You're done. Take off your gloves. You're going to, doctor, you're going to help. You're going to roll that stockinette down. Don't touch your gown.
Chris, throw it away.
Yeah, throw it away. Very nice. Very nice. Very nice. Go up over top of that if you can. Very good. Stop. Nice. I'm liking it. I'm liking it. Now, down drape. We need a down drape. It must be this one. That one right there. You and him are going to put a down drape over that table. Oh, down on the table, down here. Remember, they don't want. This is where they're going to be operating and where they're getting close to contaminating. So you guys need to unfold that, get it underneath there. There you go. Good job. Get underneath that arm. Way up in there as far as you can. Good. You're moving the arm. Just wait. Like how see how he tucked his hand away so he doesn't get contaminated. Perfect. I like that. Good. Let it go. What's the next drape? The only other drape you need to know.
split drape?
No, that's the only drape you do know. The only other drape you don't know is the extremity drape. That's the only one left. And there should be a picture telling you where the head is, where the body goes. No, open it up one. Put it back. Let me see this side. Lower end. So just like that. Perfect. Yep. Now you're going to hold it like that. You are going to put your hand, find the hole, and grab. Switch hands. There you go. Yep. You take it down to where she can get her hand in that hole. No. Fold it, keep it folded back up. Okay.
That was terrifying.
You need to put your hand, get it in there, find the hole. You get in the hole, grab the hand, let go. Yep. You guys slide that drape down. Don't be careful you don't contaminate. Be careful, slide down. Then you're going to unfold that drape as you're sliding down. Very good. Help them unfold. Perfect. It's a team thing here. Nice. I'm liking it. Good hand up. Put that down.
To the morgue we go.
And that arm can now lay back down.
Question.
Very nice. That's your typical elbow surgery right there. Extremity drape, a down drape, or a half sheet, whatever you want to call that down drape, that's fine. It has the stockinette. I liked it.
Would you do knee drapes after that or anything?
No, sometimes with these, they'll do a U-drape. Before they put the stockinette all the way down.
Right.
Instead of this drape. Got it?
Yeah.
Sometimes they'll do one because they want to get as high up as they can and they want to seal this area off before they pull this down. Because if you think about it, when this is down, okay, they cut, this is really can expose the unsterile area. So that is actually probably more common now. But this is the way it used to be all the time.
Okay.
But and then the other thing that's also very common is to do a sterile tourniquet. So they would drape it just like this without a tourniquet on, and then the tourniquet would come up sterilely. Once you put your stockinette down, all the way down, then you would put the tourniquet straight on. No Weber. This is your Weber. Got it? So what did you learn today? What did you see today? It's a little bit different than the last time. Extremity drape. What else did we add this time that we didn't do last time? Arm board. Him having to put his gloves on sterilely. Right? And then also prep it sterilely. That was something that we didn't do last time. Padding the different parts of the body So either it's supine or laterals, all you know right now, none of that's changing. So for the next group of people that are going to be doing this, I don't want the same mistakes. Does that make sense? So what you saw today is going to be the same thing for hand. Got it? And then when we do hip, we're going back to the lateral position. So you've seen this all done now. There shouldn't be anything new coming at you guys. It's all the same. It's either supine or lateral for now. Okay? So there shouldn't be any mistakes. It should move very, very quickly. Last thing tonight before you leave is I want you to play with a range of motion brace. This is really, besides a posterior, long arm posterior splint, which you guys are all doing in the clinics now, right? The range of motion brace is really the only other thing that we do for elbows. You did a cast hinge brace. I want you to play with these. This right here is a left. This is a break one. This goes down. This part here is distal to the elbow. That's what tells me it's a left. Otherwise it could be a right? But because this is distal, okay, this is different than the one that we use at the U. It's similar.